Good afternoon, friends. I'm Dr. Aajay Shah, bringing this another great weekend afternoon live. Today, I have actually a very special guest. He is actually my mentor. I've learned a lot of things from him. He himself is a cardiologist. He's a lifestyle medicine expert. He sincerely believes and follows whole food, plant-based, no oil diet. He's a best-selling author. He has a healthy living online programs and also in-person programs in Texas. And like I said, he's my mentor and my friend. So let's welcome Dr. Baxter Montgomery. Welcome, Dr. Montgomery.
Thank you very much. Thanks for having me.
Great, great. So let's start with a simple question. Where do you live and what kind of physician are you?
Well, I'm a cardiologist. I live in Houston, Texas, and my training includes, of course, general internal medicine, cardiology, and cardiac electrophysiology. And I've managed patients I've been in private practice for over 23 years. And I've managed patients with complex cardiac disease, cardiac electrical diseases, and also internal medicine problems as they relate to heart disease. My practice started out in its early days with me treating patients both acutely and, of course, managing them in the office. I took emergency room call. I did lots of interventional procedures, heart casts and defibrillator implants. I did electrical ablations and the like. And it was a exciting time, and I enjoyed the work with my patients. But over time, my thinking evolved, and I learned about issues related to helping treat the whole patient as opposed to the individual patient. And so through independent study and some personal life experiences, my practice evolved toward the approach of lifestyle intervention as an integrated approach to some of the acute care measures that we have to manage patients with. And so that's where I am now. We have my own practice. I have mid-level practitioners, medical staff. We have a nutritional team that helps counsel patients. We have an online restaurant and grocery store, on-site restaurant and grocery store that we integrate with our practice, where we prescribe meal plans, grocery plans, and the like. And so we use this integrative approach for our patients, and it brings about a unique approach. We do intravenous vitamins therapies for people with deficiencies, and external counterpulsation treatment on site, and various on-site therapies. So we have our own little cardiovascular center with therapeutics on site. And of course, I do round on my patients at the hospital, and of course, I have interventional cardiologists that I interact with who provide the procedures on my patients now that I no longer do those interventional procedures. So that's where I am now, and kind of where I've come from.
Wow, this is very impressive. I think, knowing that you had into the interventional cardiology, electrophysiology, where doctors take care of electrical problems of the heart, and now you are more into holistic lifestyle cardiology. And I think I sincerely believe that what approach you have taken, and I'm trying to follow your footsteps, is that that's the best way to overcome this chronic disease and #1 killer. Because for the last 100 years, medicine, cardiology has advanced, exponentially. But unfortunately, heart disease has remained #1 killer. So I think what approach you took for the last 25 years appears to be failing. And that's where I think a new paradigm shift, a new approach, a new model has to happen. And I think you took a lead, compared to many of us much earlier in terms of jumping into this holistic lifestyle changes. So that's very commendable. And I think many of us, including myself, are following your footsteps. And we'll talk about your program as we complete this live at the end. But let me ask you where we stand in America as a standard American diet. What are your views on what we eat every day in America?
Yeah, it's it's becoming more challenging as we speak, and when I got into this whole approach to looking at our food, my initial thinking, of course, is to get our patients on a plant-based diet, and of course that's important and it works. But now, as I step back and to some extent squint and partly focus on individual issues, it seems that our food overall, not only do we have the animal products that are just, very toxic, the way the animals are raised make them even more toxic, but then we have a lot of processed foods. So even though they may not be animal-based foods, but we have foods that have chemical dyes and preservatives and the like. And so our standard American diet is very detrimental. And I actually look at it as a drug. Many of our patients are addicted to that food. And so the standard American diet, the SAD, you probably need to substitute diet for the D with drug, the standard American drug. And what we're doing is that we're consuming substances that we refer to as food, but these substances are not foods. They're drugs that are meant to palliate or satisfy our palate and treat our addictions. And so when you think about it, when we live in an area where we have hurricanes, and I remember when Hurricane Harvey hit a few years ago. Now I was actually had to get my daughter in school, so I was actually stuck up in the Northeast. She was in upstate New York, and I got her settled and flew and hung out in DC because we couldn't get flights into Houston for about a week. And what I was hearing reports of, that many of the grocery stores were closed down. Many of them had flooded out, they lost power. And so there were many grocery stores that were closed for maybe a couple of days. And the reports I heard that people were getting ready to storm these buildings and go after the food because there was a sense of urgency. And when you think about it, just a couple of days without food, people become like drug addicts. And so it underscores the whole aspect of what we're consuming and the effects that it has on us.
Wow, I think that's an excellent point you made, that the standard American diet, or almost like you said, standard American drug, the food, the commercially manufactured food, a lot of processed food, even a lot of processed meat, almost have that addictive potential. And like Dr. Joe Furman clearly says, the fast food genocide, his book, that all this food are very addicting. And the proof, you already gave it to us, that when people could not even go 1 or 2 days without food, they were literally, looting and entering the buildings. And it's almost like a narcotic addiction or and many other addiction. I think I agree with you. This food is not just bad for us, but we are literally addicted, just like an alcohol or drug addiction. So
that's right. Yeah, and the thing about that is that, if someone's addicted to alcohol or someone's addicted to crack cocaine, it's not as bad in some sense because those addictions are not socially acceptable. So there's support to help you get off those addictions. But if somebody's addicted to baked chicken or, baked turkey or a steak, these addictions are not only socially accepted, but socially supported. And not only just in the non-medical community, but in the medical community. So if you have an illness that's being perpetuated by your addiction to chicken or eggs or steak, and you go to your healthcare provider who's supposed to help you improve your overall health condition, but they're perpetuating or encouraging the actual source of your illness, it becomes a problem.
No, that's an excellent point. Actually, I already like your point about this food, this diet as an addiction, like a drug. And I think, like you said, we would not give our 5-year-old child a pint of beer, but we definitely would give a French fries or chicken nuggets. And actually, we are making them as unhealthy and as addicted to that food as if we are giving them alcohol or crack cocaine. And I think, like you said, it's very socially acceptable, even in medical community, and it applies to every age group, starting at age 1. I mean, so it's like I said, plus it's totally legal. I mean, you can have a barbecue chicken and walk out of the restaurant, and now nobody's going to stop you. So I think that has a lot more actually pervasiveness than even some of the addictive substances, and that's probably killing us a lot more than alcohol and crack cocaine is killing us.
No, that's exactly right. And to add to your point about what we would feed our kids, just think of it this way: if you see a pregnant mother walking down the street smoking a cigarette, you'd frown on it. Or if she's drinking alcohol, you'd frown on it. But if she's eating a fast food cheeseburger or chicken nugget, as you say, you would say she's eating for two. And so it's a very unfortunate situation, and I think there's a big part of this, a mental unawareness, a lack of mental awareness, if you will, but also there's a lack of willingness for those who have some level of awareness to the extent that our food is poisonous to actually help bring about policies and do the right thing. And that's probably the biggest problem that we deal with, is the lack of willingness among the powers that be they institutions or individuals in key positions, leadership positions, who are really unwilling to be serious about addressing some of the problems that we have with food addiction and how it impacts our adverse impacts.
That's another excellent point, that I think as people of society, some of us are not as savvy in terms of keeping up with all the health related education. And that's where these policy makers, and that's where these scientists and PhDs at CDC and NIH has an obligation to teach us and to make some policies where certain industry will not hijack our taste with salt, sugar, and oil and make us eat those very unhealthy foods. So I think responsibility is as much on our shoulder as much as is on the policymakers and politicians. And unfortunately, all three are failing. Ourselves are failing, policymakers are failing, scientists are failing. Many scientists are in the pocket of this deep pocket of these industries. And I think that's where I think you and we're going to take this message to an average American and teach them that on the long run, they're actually losing on all the ends. They're losing in terms of their health. They're losing in terms of their pocket. I mean, eating at home is not only healthy, but it's cheaper too. But it's been brainwashed that fast food is cheaper than eating at home. So I think we're going to talk about all that. But let's start with your expertise. And you've done so much work on that. And that's about whole food, plant-based diet. And then please tell us the role of oil. And do we even need oil in our diet?
Well, oil, I'll start with oil. We recommend patients avoid the consumption of oils at all costs. The oil substance, or the fats that's in the oil, is in the whole food, and you really want to get the whole food. There are a lot of problems with oils, the way it's extracted, the stability of an oil when it's extracted, and it's probably less stable than any other extracted food. So if you look at an oil that's extracted, you're probably going to be at higher risk of consuming a substance that has free radicals that may cause more harm. So we tend to strongly recommend that our patients avoid oil, and many of our programs, detox programs, exclude oil from the regimen. The whole food plant-based diet, we fully advocate. I like to add the description minimally processed whole food plant-based because the less processed the food, the better. Now, we have a number of approaches that we use. We use a food prescription approach. And when we have someone who's very ill, then we have to have food that's minimally processed. Now, the exception of it minimally processed, and this, is not necessarily agreed upon by everybody in the whole food plant-based community, but we use extracted fresh fruits and vegetables in the form of smoothies and juices. And we have a pretty extensive experience using these foods in very ill populations with very good data in terms of benefits. I've treated patients in the ICU on rare occasions who are intubated, whom we have to feed these liquefied raw foods through a PEG tube. We've had other patients who are not in such severe condition who we uses extracted liquefied foods because the digestive systems are not quite intact. They have very poor dentition, they're older, and so on. And so we've had good experience in this setting. The next level are whole foods that are uncooked, but that are intact that we use. And so we use a food classification system. So level 0 are these raw plant foods that are blended or extracted in the form of raw juices or just pure water. So these are level 0. We use these in our sickest patients. Food levels 1 through 3 is raw foods, and the higher the number in that segment, the higher the glycemic index. So a level 3 food have a high glycemic index compared to level 1, and level 2 is intermediate. Level 4 is a transition zone. Level 4A, B, and C. 4A will be raw whole foods that are intact, but they have a high fat content. So for instance, a seed or an avocado would be a 4A, compared to 4B would be whole foods that are dehydrated. So you start to add some heat at very, very low temperatures for a long period of time. But water is extracted, so that makes that food less beneficial than, say, a level 1, 2, and 3, which has the water content. Level 4 is when you add very small amounts of heat, in which case it's warmed or blanched. And then 5 and 6 are cooked in the form of boiled and steamed at longer durations and higher temperatures. So from 0 to 6 is all plant-based. Now we classify foods outside of what we recommend. 7, 8, 9, those are animal product foods, or you can also have plant foods that are processed. So for instance, fried okra would be a level 8. So that's outside of what we would recommend. Oil sauteed spinach would be a level 8. So there's certain plant foods that we may consider whole food, plant-based, but the way they're prepared throws them outside of what we recommend. So we not only look at the type of food, in which case we rank plant foods above animal product foods, but if a plant food is processed in a harmful way, if you will, or have their additives such as chemical dyes and preservatives, then that puts them outside of our recommendation range. So the food classification system obviously takes in whole food plant-based, but it also encompasses the preparation techniques, because we found that that has an impact on the individual's health as well.
Wow, this is very impressive, because I read your book and I have your book, but I think I've not seen many other authors, going into the quality of food, not just the plant-based, but in terms of the processing. And like you said, I think more processed it gets, even if you eat whole food, plant-based food, and if you grill it or if you barbecue it, the quality goes down. And I think I agree with you. I think best thing is raw, obviously, with water. And I think the next best thing is steam. And then as you keep heating more and more, and as you keep making those advanced end glycation products, because even the plant-based food have amino acids and sugar. And when you grill them, when you barbecue them, they will create those advanced end glycation products. So I love your classification, and I highly recommend everyone to read that book, because your book clearly goes into details of it. And I think even though at times it appears slightly complex and intimidating, but once you understand the basic concept behind it, I think it's very, very easy to understand. So let me ask you your next question, and that's a role of fiber. For last 2-3 years, fiber has become the most important nutrient. There are a lot of good books coming out. So what are your views on fiber?
Well, fiber is very important, and obviously plant foods have lots of fiber, and I think it's really important that we get a lot of fiber in our diet. But I would argue that, let's say if I eat a cucumber, or I eat, kale or spinach, etc., those foods contain fiber, but they also have fiber in the contents of water. And what I'd like to encourage people to consider is that plant foods have fiber, and therefore fiber is a positive contributing factor. But I try not to isolate fiber in the sense that we isolate other nutrients, because as Dr. Campbell puts in his book, Whole, we have to think of the whole food as a constituent, that has multiple constituents that are working in synchrony, as a symphony would be. And so fiber is very important. But for instance, if I were to lecture my patients, say, okay, get more fiber in the diet, then they may go and get some kind of fiber supplement and add that to the diet. And, maybe they have a lot of that and have it with their baked chicken. I don't know. And maybe not drink enough water. And so fiber is very, very important. I'll say that point blank. But I really like to emphasize that people get their fiber in the context of whole plant foods, because those whole plant foods also have water. And I tend to think that water is probably the most important nutrient with fiber being a close associate, if you will.
No, I think that's an excellent point. As a matter of fact, Dr. Kaushik Reddy, which we both know, is watching the live, and his famous statement is that when we go to grocery store, we don't ask that give me 2 grams of fiber, 4 grams of protein, 7 grams of fat, and 5 grams of fiber. You know, we don't say that. We just ask for the whole food. And like you said, Dr. Campbell in his book, Whole, clearly says the people who become reductionists are the people who become the biggest losers. So I agree, fiber should not be emphasized as a fiber, but as a part of whole food. Otherwise, people will misunderstand. You made an excellent point. People will misunderstand and they will reach out for Walmart fiber supplements and think that they're getting enough fiber and they will be healthy. But actually, like you said, they're eating chicken with the fiber supplements. So I think that's an excellent point you made. And that comes down to the next nutrient, which we can probably argue about the same way, and that's about protein. I think, as I understand, as American, we eat a lot more protein than what's been recommended, or what's been safe even. And then obviously there's a question about plant-based protein versus animal-based protein. So what are your views on protein?
Again, you know, protein is important in the sense that, you know, the body makes it and uses it. And you don't have to consume the flesh of another animal or an animal to get protein. Our body, our liver makes protein with consumption of the essential amino acids and carbohydrates. So I think we overemphasize the importance of protein. I think if somebody's consuming a healthy diet with calories, then you're going to get adequate protein. If you consider what animals consume, if you eat an animal who eats a plant, that animal gets its protein from the plant. Cows get their protein from grass. Now, of course, if you eat an animal that eats other animals, they get their protein from an animal that got its protein from a plant. So the original source of the nutrient protein, as the original source of other nutrients, comes from the plant. So from the standpoint of getting adequate protein consumption, you're going to get it from plants. I have a patient that I remember treating who came to our site, and he was very ill and he had systemic inflammation, and his albumin, which is what the major protein we measure in the blood, as you know, but just for the sake of the audience, was very low. It was normal is 4, his was 1.7. And so he had tachycardia, put him in the hospital, he had atrial flutter, arrhythmia, and we treated all of those things, but I put him on a raw detox. I actually put him on raw smoothies and the like. And during the detox, his protein level went up and improved. And so he got better, his swelling went down and the like. So after getting out of the hospital, he continued the detox for a while, but then he got off the diet. He cheated a little bit. He had soup that had some animal protein in it, etc. What happened is that consumption of that animal protein, because he wasn't fully recovered, it triggered an inflammatory flare, which then dropped his albumin level back to 1.7. So, and we have a graphical display showing his albumin going up on the raw detox and it dropping on the animal protein consumption, and then going back up after he got back on raw detox. So the low protein level in individuals that we may see in the United States primarily are due to one of two major reasons. There's a third potential one, but we see a lot with inflammation. So somebody comes in with a systemic inflammation due to an infection or inflammatory condition. As you know, the capillaries can widen and the albumin leaks out, so the protein goes down there. Other individuals who have significant liver dysfunction, and we're seeing a lot of people who are non-alcoholics who have liver dysfunction related to many of the medication they're consuming over time, the processed foods with chemical dyes that's putting stress on the liver. So individuals with liver dysfunction will have a low albumin because the liver is responsible for making a lot of the protein. So those are the two major reasons. There are also other people who maybe have true malabsorption syndromes, and that could be inflammatory mediated or some other mediated process where they're not absorbing their nutrients. And so these are people who are truly malnourished. But if you are getting nourishments on a regular basis and you don't have a significant inflammatory condition where you're leaking protein, or you don't have a liver dysfunction where you're not making adequate protein, then protein should not be an issue for you as long as you're eating. The only people who are protein deficient or people who are severely food deficient and not getting any nutrients, and then that's another issue.
No, that's an excellent point. I think nature, I always said nature is great. The ratio of all macronutrients in natural food, whole food, plant-based food is perfectly designed by the nature over billions of years. And that typical ratio, if you have a whole food, plant-based plate, the ratio is anywhere between 10 and 15% protein. And I think if I eat 2,000 calories based on my body weight, that's about 50 to 75 grams of protein. And that's exactly what's been recommended and what's been shown to make the maximum lifespan. So I think nature is great. If we just follow what nature has done for us over billions of years in terms of what kind of macronutrient we should have, then typically we would know the protein should be no more than 15% of our calories compared to the keto and paleo diet, where sometimes the protein can be as high as 25 to 35% of the calories. And I think that's where definitely protein has been overemphasized by the industry because there's a lot more money to be made selling the protein than selling broccolis and kale and spinach. So I think I agree with you. And again, I like your idea about not becoming a reductionist and talking about whole food, not talking about protein, not talking about fiber. I think that's a great suggestion you made.
And one point in those other diets that you mentioned is not only the amount of protein that they're recommending, which, as you point out excellently, is wrong, but also it's the type of protein. So even if it was 2 to 5%, it's the wrong kind of protein because those protein trigger inflammation and other problems. And so it's you want to get the quality protein, which is a plant-based protein.
Yeah, I think I agree. And that brings another important kind of a burning question. We just recently had a study published that a woman who drinks a glass or two of milk every day has a significantly high risk of developing breast cancer in the future. And I think dairy always has been taught as like something for strong bones, something for building a muscle, something for calcium. I sincerely think dairy is not only not necessary, but can be actually very harmful. So what are your views on dairy?
Well, I mean, you shouldn't have to remove dairy. We remove dairy from the diet. It's, I don't have, strong data on this, and you may have, I haven't really searched it to research it in my infinite spare time, but, you might make the argument that dairy is probably at the top of the list of forms of animal foods to consume. I mean, and we have a pediatrician colleague who I collaborate with, and she clearly says that, one thing she does off the top with her families, with the kids, is to remove the dairy 100%. And a lot of their inflammatory conditions are under control, even without, removing other foods. And so, dairy, I think probably if we really look at it closely, we'll find that dairy probably has extra problems above and beyond the animal flesh foods, which of course they have a lot of problems as well. So we're staunchly against the consumption of cow's milk or cow's dairy or goat's dairy, any other animal's dairy other than humans' food. But yeah, I think that's really important that we avoid dairy, with the exception of the baby, breastfeeding.
Yeah, I think I agree with you. Again, that brings another little bit of kind of controversial in some of the giants in whole food plant-based, like, for example, Dr. Furman versus Dr. Elsestin. And I've asked that question to many experts, including I'm asking you now, that what do you think of the role of nuts in terms of health, in terms of heart disease, in terms of reversing heart disease, in terms of weight loss? Obviously, nuts are very calorie dense food, and we never stop eating at 1 ounce of nuts, which has been recommended by Dr. Furman. I remember a lot of people, including myself, stopping at a gas station, picking a bag of cashews, which has 800 calories, and eating the whole bag in half an hour of driving. So I think nuts, in my opinion, still remain controversial. What are your views on nuts?
Yeah, I mean, like other things, we have to put them in context. And so in the abstract, to say nuts are part of a healthy diet, I think is a valid point. And I agree with that in the abstract. But then if we come to reality, as you pointed out, we have to look at our circumstances. Nuts are designed in hard shells that are hard to crack, and you got to climb a tree and knock it down. I remember looking at a wildlife show, these little monkeys, and there was these nuts that had to climb up and shake the tree, and they knocked the tree down. Then they had to get this big rock and crack it, and then I mean, so the nuts are designed to limit your consumption and also, create some level of reserve. So I think that's one aspect of nuts. We, as you said, go to the supermarket and you got them in these bins, and go put them in your bag, and you got them in your little container. You're shopping, and by the time you get to the cashier, the nuts are half price. And so it's the context of what we're eating nuts. And so I think there are points to be made on both sides of the argument. I'm familiar with Furman's point. I think that the diet should contain nuts. We recommend consumption. We actually limit to certain types of nuts: walnuts, pistachios, pecans. We say the nuts should be raw. We try to emphasize, controlling the consumption of nuts, because it can be problematic. It's you can buy nuts that are not in the shells, and it's just like, you go to town on them. And our bodies are designed to crave fats and store fats, because we're not designed to live in environments that have refrigerators and freezers and pantries, but rather to be out scouring. And so by the time in perhaps the old hunter-gatherer days, you crack a couple of nuts, you might get chased away by a bear or something. So so you got the element that limits your consumption. But I think by and large, nuts are important. I don't think they should be excluded from the diet. But I will say this, and this is something that I strongly emphasize, is that I think your nuts and seeds, and I prefer seeds over nuts, they should be consumed in the raw state. And oftentimes when we get these nuts at a shell, sometimes they're heated or steam shelled, or as you mentioned, people go to the gas station and get nuts. They're probably roasted or processed in some way. And so these are not the healthy form of nuts. And so if you would do like a survey study and look at people that eat nuts, you may find some adverse problems depending on the kind of nuts that they're eating. So I think nuts are important in the diet. They should be consumed. They should be raw, and they should be organic and minimally processed. And ideally, you should consume them from the shell. I mean, that's something I don't mention a lot, but I probably should. Your nuts you should shell them yourselves. And I think that should be a recommendation, a dietary recommendation that we make, that people consume nuts that are shelled. And in fact, as I'm talking and thinking in our grocery store, I think that we may convert all the nuts that we sell. We don't sell a lot of them, to just nuts in the shell, to force our people to actually have to crack the shell.
I'll tell you one thing. You just reminded me of my childhood. When I was 7, 8, 10 years old, my parents used to give me walnuts with a shell, and we had to crack. And fortunately, my teeth were strong enough back then that we would take that whole walnut with a shell and crack it, and then eat the walnut from inside. And that took an effort. And I did not eat more than 2 whole shell walnut, probably per day. And here, like, we get a bag of walnuts ready to eat any time of the day. So I think I agree with you. I think that's another excellent point you made. Plus, like you said, a lot of these nuts are processed. Many times they are salted, many times they are roasted. And like you also said, seeds are preferred over nuts. And I think in my also agreement that, small amount of seeds and nuts has to be part of a healthy diet, even though, some, like Dr. Esselstyn, but I think I agree. I think for an average person like you and me, a small nuts and seeds are important for our diet. That brings some of the another topics which are kind of still floating around. People are still going back and forth. And one important topic, which I've not asked many of our guests, but I want to get your views. And that topic is caloric restriction. Obviously, we know that into some of the smaller animals, even into monkeys, I think caloric restrictions not only prevent many chronic disease like diabetes, but also possibly make them live long. And in humans, those studies are difficult because those are long-term studies. But in humans, we did not see that much differences yet. So what are your views on caloric restriction?
It's a good question. It's a good point. I haven't studied the data on calorie restriction. What I can say is this, and again, we have to kind of put our current condition in perspective to, what our natural environment should be. And, if I remember when I was young, actually in school, you didn't have, there was even a difference then to now. You didn't have all the availability of foods. And so, when you're in an unnatural environment, let's say, for instance, someone lock in this room with, a room with cashews all up to your neck, you'd probably eat until you die within the first 30 minutes if you're addicted to cashews. And so calorie restriction is really something that should be natural in the context of your life. The fact that we are in an environment where we're sedentary most of the time, we're indoors, we have food that's stored out the wazoo, we can go and pick up food anywhere, and so on. And our bodies are designed to consume and want to consume food, then that's an artificial environment. And so in that setting, you have to create some barriers, which are artificial and barriers. So in that context, those artificial barriers are a natural restriction of calories. Now, when we put patients on a detox regimen, initially we don't restrict calories. And the reason we don't is because we're transitioning them from a standard American diet that's addictive to a raw plant-based diet. When we saw patients consuming raw plant-based foods in its natural state, we said eat as much as you want, and we provided the meal plans. This is our published data. We saw that their caloric intake naturally went down. So there's one aspect of getting us to a natural environment. I alluded to one, meaning that an environment outside of the natural state, if we had to grow our food or scavenge for our food or hunt our food and so on, and didn't have these supermarkets that were walking distance, that would be one aspect of the environment. The other aspect of the environment is how our food's prepared. If we're consuming food raw in its natural state, then our consumption of that food would actually be limited by the biochemical reaction that the food has with our system. The old saying, the Lay's potato chip company, you can't eat just one. And they weren't talking about you can't eat just one potato chip. You can't eat just one case of potato chips, because the food is designed to make you want to go back. But if we're eating natural food in its natural state, then there's some level of natural calorie restriction because the body becomes satisfied. Now, having said that, sometimes you have to even extend it beyond that. And that's where intermittent fasting comes into play, water fasting. And keep in mind, we all intermittently fast by and large, because when we go to sleep, let's assume that we all go to sleep every night, whether it's 4 hours or 8 hours or whatever time period. During that time, we're not consuming food. And so we are fasting. So intermittent fasting is a natural condition, and it's a natural health state or health exercise or cycle of the body. So sometimes you may extend that fasting. So you sleep 8 hours, and then you may fast 4 hours before and 4 hours after you sleep at your sleep time. So that gives you a 16-hour fasting period. And we actually have food prescriptions that prescribe certain intermittent fasting protocols. So calorie restriction, I think, is good. I like to think of it more along the lines of fasting, intermittent fasting, and I also like to think of it in the lines of consumption of natural food in this natural state. Because if we were to generically say calorie restrict, then I say, okay, I'll eat only 1/4 of a cheeseburger that may only be 120 calories, and I'll eat nothing else all day. And that's a calorie restricted diet. However, it's not a healthy diet. And so again, I like to put these things in context. And yes, calorie restriction is good, but I like to describe it in kind of a mouthful of words: natural foods in its natural state, intermittent fasting with water, sleep, and the like.
I think that's an excellent point. And I've never heard the way you describe in such an elegant way, because if you look at the caloric density of natural whole food, plant-based food, it's very low. And if you look at the diet in Okinawa, not now, but I'm talking about 100 years ago, they were thought to be caloric restricted naturally. They did not have the science, they did not have the recommendation. They just did it as if they were living the life. And their life was mostly whole food, plant-based. And I think when the life was whole food plant-based, they automatically were actually doing, and without even their knowledge, they were restricting calories. And like you said, I think the reason American diet sometimes has gone up to 2,500 calories compared to like 2,100 calories just 30 years ago is partly because we have gone away from the whole food plant-based diet in the last 30 years. So now we are talking about caloric restriction because actually we are eating wrong type of food. If we eat right type of food, which you recommend, truly the caloric restriction concept automatically happens in every person. So I mean, you made an excellent point that if you eat whole food, then the calorie restriction automatically just happens, which is the most healthy thing to do. So that's an excellent point you made. I like it the way you described it.
And I like the point you integrated by certain societies that naturally calorie restrict, because, you look at these different blue zones, and the one thing you see is that there's a global aspect of their life. And one thing I'm working on and integrating in my patients' lifestyle is the aspect of getting outdoors. And we're in the next few, I don't know, weeks, months, going to actually put together lifestyle protocols that actually tell our patients to actually start gardening. Now, gardening is one thing. There are other things you can do in the outdoor space. But one thing I'm learning personally, this is part of my personal journey, is I'm being more intentional in getting outdoors. So in my morning workouts, I have a gym in my house, but I don't use it anymore. I've used it maybe once in the last several months. My trainer comes over a few days a week and I work out on my own a few days a week. But I'm just in my backyard. And whether it's raining, as long as it's not lightning and thundering, that's the only time I worked out in my gym. There was some lightning, but I worked out in the rain, mud, the grass, and I get dirty. And this whole aspect of being outdoors on a regular basis is important. And I'm trying to integrate the outdoor space more, even though I have a job that's sedentary, that's indoors. I've got my garden I'm working on and other things, and I'm encouraging more people to do that. Why? Because as we take our whole life and we start to do things that are natural, outdoors, working, lifting, bending, we're going to build up endorphin levels that help stimulate the pleasure centers. And a lot of what we deal with in terms of food, we talked about the addictive nature of the types of food we're consuming, which are stimulating these receptors. But the whole aspect of the lack of other things, the lack of outdoor living, et cetera. Of course, in lifestyle medicine, we talk about relationships and love, and these also things that stimulate the pleasure centers. But these are different inputs into the brain that influence how we behave and how we feel and globally how we live. And I don't want to get too much in a tangent, but I think it's an important point to make because we're talking about calorie restriction, but part of calorie restriction becomes a natural process the more we put ourselves in a natural environment as to where we need to be. And so being outdoors is part of that process of a natural environment, as much of that as eating natural food. And so if you're outdoors growing your food, you're eating locally, regionally, seasonally, and you're outdoors, you're getting vitamin D, you're with the bugs, you're getting your microbiome is getting healthier. And so in that environment, that's going to contribute to your consuming a healthy diet and restricting your diet accordingly, because these all have inputs into your brain in a positive way.
I think that's an excellent point. And I think actually I'm watching our Facebook feed. And again, Dr. Kaushik Reddy, which we both know, made the same point that, blue zones, not just eat healthy, but they move every hour. They're gardening, they're walking the grocery store, picking up those 2 big bags and walking home. So I think they do a lot of things which are just more than just healthy eating. And I think your point is excellent that when we get out in the nature, and your suggestion of gardening actually serves many purposes. It gets us out in the sunlight, it gets us out with the growing plants, and seeing growing plants has so much purpose in life. It gives us a free, healthy, whole food. I mean, it gives us some physical activity, banding, it gives us some stretching. And I think so gardening is an excellent recommendation. And that's what I like about you, Dr. Montgomery, is that you're a very common sense person. And I think you put the science and practicality so well together. And that's, I can just already feel it in our first half an hour. So let me ask you a practical question. A lot of our viewers, listeners, they're gradually changing their lifestyle, thanks to what you and I've been putting for last years and years, but they still are asking more questions that how can they start this whole food plant-based lifestyle from eating meat or dairy or animal products pretty much every meal of the day. They want to start, but they are looking for more tips, more practical ideas, and more guidance. So what is your practical tips on that?
Well, I mean, getting started, marking your calendar, putting a game plan together, meals. Sometimes you can start off by, let's say you're eating a standard American diet, but before you make the plunge, you can start consuming foods in the plant-based kingdom to say, okay, I like this, I don't like this, I love this, and so on. And so even before you make that plunge or you commit to plant-based diet for a certain period of time, you can start to survey plant-based foods that are healthy and recommended. There are lots of sites, your site, my site, that has recommendations and the like. There are many books that are out that have healthy food recommendations. So you can start off by surveying those foods, and then you mark the calendar and you say, okay, I'm going to commit myself to this diet for this period of time. And I wouldn't just, I would give it a finite period of time. We tend to recommend our patients do it for 4 weeks. And so you have a beginning and an end point to where your mind can you can put your arms around it. Oftentimes, depending on how your brain or how you perceive this change, if it seemed to be an extremely drastic change, then you want to, create a start point and an end point that's finite. And I like to go with 4 weeks. Sometimes it may be tough with people, 10 days. You don't want to just do 6 or 7 days. The first week you go through detox reaction. So you want to get beyond that where you start to feel some of the benefits. That gets you at least 10 to 15 days, preferably 28, 30 days. But long story short is that you want to initially survey plant foods, come up with things that you like, and then create a game plan, start and finish date with foods in that time period so that you have a plan and that helps you get through it. That's if you're doing it on your own. Of course, there are lots of sites where you can get help. And we have a program, the online boot camp class, where we put patients through detox and we walk you through that whole process as well.
Wow, those are excellent tips. And I think I agree with you. I think we are not asking people to make overnight 100% drastic change in their lifestyle. I think they can take their own pace. They can reach out to your programs, many other programs. They can read books. They can watch some of the videos I have created. But I think the goal here is to, go away from that standard American SAD diet. And quicker you go, quicker you will feel better. And a lot of people, actually, from my personal experience, when I asked my patients to make that change, they got actually so much better so quick that they only want to do quicker and faster, because some of the patients who made even 50% switch, they felt 200% better. So they want to complete that 100% switch because they want to feel 1,000% better. So I think once we get them on the beginning, the first step in the ladder, they actually want to jump and just go up on the ladder so fast. So I think we need to help Americans. We need to help the world just to make the first 1 or 2 steps. And after that, the power of whole food plant-based will take over, and they actually will themselves climb up that ladder pretty quickly. So I think that's what I personally believe, that we just need to get them going for first 1 or 2 steps. So that brings my next question from your own experience. You've been doing it for decades. What are some of your views and your experience when it comes down to reversing many chronic disease, including heart disease, diabetes? How effective the whole food plant-based, no oil, and your programs, your classification from 0 to 9 level, how effective they are in terms of reversing diabetes, heart disease, many other chronic disease?
We found it to be very effective, and what our approach is to provide our patients with, we use the nutritional detox model, and I like to liken it to a bolus dose of a medication. As you're familiar with, you may get someone on an intravenous drip of a medication, but they'll have to get a bolus dose to get the levels up. And we use the raw detox diet as a bolus dose. And we typically do it for 28 days or 4 weeks. And what we found in that experience, in that period of time, we get significant reduction in inflammatory markers, blood pressure reduction on average goes down, cholesterol, and we even showed a significant reduction in LP(a), which is, as you know, an atherogenic particle that, independent of cholesterol levels, can predispose you to heart attacks. So we would first, in the literature, show dietary changes affect that, 16% reduction in 4 weeks. But our experience is that with that adjustment, then after that time, we put patients on a maintenance whole food plant-based diet that includes both raw and some boiled and steamed foods. And we find that they're able to stick with that longer because in the initial 4 weeks, their taste buds change. And so with the change in your taste buds, that has a psychological benefit, and it helps you sustain. Just as I sort of say jokingly in part, after 4 weeks of grass and water, steamed broccoli and bean soups is delicious.
Yeah, that's an excellent point. Somebody on the Facebook asked us the question that who are the authors we would recommend. So let me read out some names and maybe you can add more. So I definitely would recommend Dr. Joe Furman, Eat to Live. I definitely recommend Dr. Michael Greger, How Not to Diet. I definitely recommend a lot of Dr. Neil Bernard's book. Definitely recommend the China study from Dr. Campbell. Definitely recommend Undo It from Lynn Ornish. Definitely recommend Brenda Davis book. Your book, Dr. Montgomery's book, for sure. I have Dr. Montgomery's book and I highly enjoyed it. A lot of great tips on it. Who else I follow?
Dr. Esselstyn, I think.
Dr. Esselstyn's book on reversing heart disease is a great book. So I think there are a lot of authors, but I highly recommend to get 1 or 2 books, not get overwhelmed with getting all the books. Just get 1 or 2 books, read them, ask more questions, watch a lot of YouTube videos, and then reach out to Dr. Montgomery, reach out to me. I mean, we both are available on our page and it doesn't cost anything and we always respond. So I think just start small and build it up.
And don't forget Dr. Greger's book, How Not to Die.
How Not to Die. Yes, I think Dr. Greger's both books are excellent books. I think if somebody wants to start with the one book, I would get How Not to Die. I agree with you. And Eat to Live, those 2 books. So my next question to you is that please tell us a little bit about your online program, how people can look you up, and how much this detox program for 28 days costs, and how can people sign up? A lot of our followers and viewers want to start this program like tomorrow, and they all are tired of staying sick. They all are tired of diabetes, high blood pressure, heart disease, obesity, sleep apnea. They all want to lose weight in a healthy way. And many times, they are not getting the guidance from their own doctors. So I think we want you to explain how can people sign up with you and how much it costs.
Yeah, so basically the website, I think I emailed it to you if you want to put it in the chat, but it's online.montgomeryheart.com. Our website is montgomeryheart.com. So you go online.montgomeryheart.com. That takes you to the page where you can sign up. The program is really an extensive program. It has a number of sub-programs part of that. The cost is $249 for the year. So it's less than $24 a month. And you have access to the detox program, which walks you through the detox, the 28-day detox. You also have access to the maintenance program, but you also have access to a forum where the patients, individuals who are part of that, they're posting questions and my nutritional team is addressing those questions. You also have access to a recipe library. We're constantly coming up with different recipes and we do video demos of those recipes. So you have recipes plus video demos on how to prepare it if you need that. You have access to monthly webinars. There are topics, key topics that our nutritionists put together and address certain issues. I do a quarterly summit where I go on and talk about a critical health issue. Also, twice a month, there's a Zoom session where you have access to our nutritionist. If you have any questions, you can post those questions in the chat room, or you can also post recipes and menus within that setting. So you have access to information that other people are providing, as well as you have questions that you can be addressed by an expert team. So in summary, you have a year's access to all the material, and we're constantly producing new material. We're constantly producing new recipes, new recommendations. I'm actually currently working on a masterclass that I'll make the recordings available in this program, where I'll go on and do discussions with individuals, medium-sized groups, where I'll take them through a detox. That'll be the Dr. Montgomery Detox Masterclass, a maintenance masterclass. So you'll be able to interact with me. So that'll eventually be a future component of this at discount rates. And so getting part of this community is the critical factor. And it's not about this program or that program or this product, but just getting in that community. So if you want to detox, you have that information. If you don't want to detox, you have other sources of information to help educate you and build. And it's a building process over time. Just getting connected with the community and having access to an organization that has been utilizing this approach from an integration and intervention approach in the real setting. We have people that come from all over the country with many different illnesses: kidney failure, diabetes, heart failure, inflammatory diseases, cancer, all sorts of illness that we're working with in an aggressive manner. So the things that we've learned over the years is being implemented in this program. So getting access to this has numerous values in terms of not only getting started, but also maintaining your health journey.
I think, to be honest with you, knowing your program personally myself, reading your book, knowing you at a personal level as a mentor and as a friend, $249 a year, that's less than $1 a day. A lot of us spend coffee for $2-3 a day. I mean, this is for your health. Many of us, some of us, the patients, have prescriptions which can cost $200-300 a month. Insulin is so expensive. So I think, to be honest with you, $249 a year with all the access is almost a steal. I think everybody who is serious about their health should reach out to your program and should reach out to whatever program they like, but they should be spending, in my opinion, at least $300 to $500 a year for their own health. If they do that, on the long run, not only they will save lots of thousands of dollars, bypass is $60,000, but a lot of suffering, a lot of dying early, a lot of misery, a lot of missing out on the great family events. I think once a person has a stroke, cannot go to any family event. So I think your program is just so valuable in every person's life. So I sincerely think a lot of our followers and viewers should look you up and should sign up with you. So again, Dr. Montgomery, thank you for coming live on our program. This was one of the best interview I had. This will be on YouTube in few hours, so it'll be available to everyone if they want to watch it again and again. Please share the YouTube video. Please subscribe to our channel. And if Dr. Montgomery has any final comments or thoughts, please go ahead, Dr. Montgomery.
Well, no, thanks for having me. This has been a pleasure. It's always a pleasure. I mean, this is my passion, is your passion, Dr. Shah, and it's always a pleasure to get on and share information and advice. And what I often like to tell people, because there are a lot of challenges. I mean, and we understand that there are family issues, there are work issues, and they're just patient. Individuals have just so many things going on in their life. And what I try to encourage people to understand is that, investing in your own person is both directly and indirectly a way that you invest in all the other things that are going on. If you have children that you have to look after, you have to enhance who you are and your health to better enable yourself to take care of your kids. If you're running a business or you're doing many different things, you may have a ministry, whatever the case may be, your investment in yourself, both indirectly and directly, it's going to allow you to execute all of these other things, which we think of as distractions, but it's really going to help you execute all of these other things to a much greater degree of efficiency and effectiveness. So that's one thing to take into consideration. The other aspect about lifestyle change, we all, struggle with it. We all, I get up in the morning when I started back working out after, I finished this busy series and I hadn't been working out, started by working out with my trainer. I get up in the morning loathing it. And as a psychological barrier, you have to break through. And the same thing with any kind of lifestyle change. But once you've broken through it, the mental aspect of it becomes less of a barrier over time. It becomes natural. What I will say is the following. You really have to work and fight and make a lifestyle change on your terms. You don't want to allow some disease to creep up in your life, some illness. Heart attack don't, wait. It doesn't have a schedule. It comes at any time. You have a family wedding, heart attack shows up, wedding gets postponed. I've never seen anybody postpone a heart attack, postpone a stroke, postpone a decompensated heart failure for a meeting or anything. Those illnesses hit, they say, I'm here and you deal with me now. So the point is simply this. You make the lifestyle change on your terms. Don't make a lifestyle change on the terms of a stroke, heart attack, kidney disease, diabetes, etc. Take the action now. If you are, burdened with one of these illnesses, then turn the tide. You change the tide from turning it, and then you start to enhance your body's well-being, make aggressive moves, and the first move is to take action here and now, or at the very least, the first action, mark your calendar and say, okay, this day, this time, I'm going to take a stand for my own health, for my own life.
Wow, such a great closing point you made, that don't let the disease or an event, a heart attack or a stroke, dictate your lifestyle. Start the lifestyle before they hit you so you can actually prevent them, and many cases actually reverse them. I think the lifestyle has such a tremendous power. So thank you again, Dr. Montgomery. We'll be bringing you back in a few months and wish you the best with all your upcoming programs. So hold on one second, I'm going to go off live.